Hello, I'm Christopher Stout, vascular surgeon at Ozark Regional Vein and Artery Center. Today, we're going to talk about your experience coming in for a procedure and afterwards. The OBL is an outpatient lab that us physicians run, and we do multiple different types of procedures in there. But it's important to understand and follow the directions that we're going to provide. Before you come into the OBL, there's going to be some very important things that we need to consider. Ozempic, Wegovy, those new GLP type drugs that are used to control diabetes and for weight loss, those slow down your GI tract. So you have to hold that medication for a week beforehand, because if everything slows down, there's a higher risk that you might throw up and feel really sick for multiple days after procedure. Different types of blood thinners are going to need to be held. It may need to be held for a day, or it may need to be held for 3 to 5 days. We don't hold aspirin and Plavix and Brilinta. We keep patients on those. So with the medications, we may want you to hold them. Some of them we want you to take. Generally, I like to have you not to eat or drink anything after midnight, and that gives me a good 6 to 8 hours before we do the first procedure. You should be able to walk 25 feet or less to get into the building for wheelchairs and everything else, and generally you'll check in right as soon as you walk in the door. We'll have to start an IV in your arm, because when we do these procedures, we give a twilight sleep, much like a colonoscopy type sedation. And then once we're done with the procedure, we generally use some type of device to make the hole in the artery or the vein to stop bleeding, and you go back to the room that you got ready in with your family waiting for you. And then once you're ready to go, my nurses will come in and give you a lot of instructions to follow for the next few days, in addition to follow-up appointments and ultrasound appointments, which we'll schedule. Most patients are able to leave within a couple of hours of having the procedure, most of them within an hour. And when you go home, I want you to take it easy for the first day. So we will do an ultrasound at your first visit. And generally I'll do an ultrasound at 1 or 3 months, and then we'll do it again 3 to 6 months later, and then again 6 to 12 months later. And once you're in the practice, we'll follow this forever, because not only do we want to make sure that the treatment works and is durable, and if it does come back in the little area, we can go back and do what we call a touch-up, and a very quick procedure again to go in there and open that back up for you. And then we start over with the monitoring. We have a nurse on-call number to call with any questions or concerns, and then you'll also get a cell phone that gets you Dr. Stout, myself, or Sharon Apperson, my nurse practitioner, just in case you can't get a hold of anybody else. If you have any further questions, please give us a call, log on to the website and request an appointment. We'd be more than happy to explain all of this and give you the treatments you need.